this one real quick, all right? Well, actually, let's talk about this one, actually. It says, a nurse is collecting data from a client who has bipolar disorder and is experiencing acute mania or mania. Which of the following findings is the nurse's priority? Now, first of all, what's bipolar disorder?
Bipolar is when you have, you can act different at times. You can be one way and changed.
Yes, you act different, but a lot of people think that bipolar disorder is like multiple personalities. That's not correct. Did you think that before? That bipolar was like, you're like two different people?
Yes, I did. I thought you can
so did I.
Change.
When I was, look, we all think we have a friend that's bipolar until we meet a patient with bipolar disorder. Have you ever seen the movie, shit, I don't remember the name, but there's this movie, it's called Split.
No, I haven't seen it.
It's this movie about this guy that has multiple personality disorders. That's different when your brain makes up different personalities. Like one patient could be a 36-year-old woman, a 12-year-old kid, and a 22-year-old man. That's multiple personality disorder. That's not bipolar. Bipolar is this. When you're bipolar, it's somebody that their emotions swing. What was that?
I'm joking.
What was that?
I said I must be bipolar.
Well, you think you are until if you ever meet someone that's bipolar, you'll be like, oh no, I'm just a little crazy. Let me explain this real quick. There's something called affect. And I want you to know that affect means mood. Okay? And specifically, affect is your facial expression.
Oh, okay.
That describes your mood. Fair enough, right?
Right.
Sometimes we've met people that have that resting bitch face, right?
Right.
Or people that just always look happy, which is equally annoying. My point is, when you have bi means two, okay, and polar is talking about ends, meaning like opposite ends. It usually swings from being severely depressed or depression. Let me say it like that. Okay. It goes from depression to something called mania. And that's what that word in the question was. Now, when you're depressed, your mood is low. You don't want to get out of bed. You're sad. You're crying. You think that there's nothing to live for. You're constantly sad no matter what happens, correct?
Right.
But when you're manic, this is very different. It doesn't mean that you're happy, but your mood, your affect is really high. Have you ever met someone? Honestly, maybe you are. No, I'm just playing. Every morning that I see you, Miss Jennifer, you are walking around really fast, and you're tall, so you're very noticeable. And
been told.
Right? And you're hustling. Like I see, you're clocking in, you're doing this, you're doing that. People that are mad, they can't stop moving. They suddenly have an increased energy. And they want to complete so many tasks. They're like, oh my God, I have to go shopping. I have to go buy my socks. I have to go get my COVID test. There's so many things to do. Notice how what I'm describing is not necessarily happy. I didn't say happy. Their energy level is just really high. And they want to talk about a bunch of stuff. What was that?
Oh, because I'm always moving.
You're always moving, but I doubt you're depressed.
What my supervisors always say about me. I'm always moving and like
you're always moving because when we're moving, we stay busy, right? But
right.
somebody who has bipolar disorder, one day on Monday at 2 p.m., they're so sad that they can't get out of bed. And then by Tuesday at 8 a.m., they can't stop talking about the new whatever at the mall.
Right.
Whatever at the mall. They're like, oh, I gotta go to the mall. I have a bunch of stuff to do. I have to go to the DMV. I have to go to the mall. I have to go to get my oil change. I have to go grocery shopping. I have to cook. Oh my God, the house is so dirty. I have to clean it. That's mania. It's kind of like they're freaking crazy and they just can't stop moving. They can't stop carrying out physical activities or activities in general. That's bipolar disorder. And then it switches again. Later on Tuesday, by, let's say, 6:30 p.m., now you're like, life sucks. You know, I hate this. And you start crying and you become very emotional. Oh my God, I'm not happy where I am in life. And suddenly you're shut down and you can't get the patient to participate in activities. You can't get them to join the watching a movie or any of those things. Does that make sense?
Yes.
That's bipolar disorder. Okay. I want to explain one more thing when it comes to mental health. There's something called positive behavior. And there's something called negative behavior. This is not what you think it is. Positive is not good. Negative is not bad. Both positive and negative, it's talking about your activity level. Okay?
Okay.
What that means is this. If I am talking a lot, is that a lot of activity or a little bit of activity?
A lot of.
That's lots. So if I'm talking a lot, that's positive behavior. Does that make sense?
Yes.
If I'm crying a lot, and this is where it gets tricky. If I'm crying a lot, is that positive or negative behavior?
I would think it would be negative.
You would think it would be negative because that's bad. But remember, we're talking about activity level. If you're crying a lot,
it would be positive level.
That's positive behavior. Does that make sense?
Yes.
If you are thinking about killing yourself and you're telling me, I'm the nurse, and you're telling me I'm going to kill myself, I can't wait till you go away. After your shift ends, I'm going to slice my throat. Is that positive or negative behavior?
Positive.
That's also positive behavior. But what if I'm just sitting there looking out the window, saying absolutely nothing and doing absolutely nothing?
That would be negative.
That is correct. Now you understand how we use positive and negative behavior in mental health. Have you ever heard of something called catatonia?
No.
Have you ever heard of this one? Pop and lock?
Pop and lock, no.
You've heard of pop and lock. When people get down, when they dance, they're popping and locking.
Yeah, but I didn't think about this.
Well, this is the medical term. This is not, okay?
Okay.
I'm just giving an example. You know, when you're popping and locking, there's a moment where you're moving around, right? You can see hold on, let me see real quick. You can see my hand, right?
Yes.
Okay. When you're popping and locking, there's a moment of popping, boop, 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 right? And then there's locking, right?
Right.
The popping is positive behavior. The locking is negative behavior. Okay. When you're locking, you're not moving at all. You kind of like, watch, let me show you. When people become catatonic, they stay in that same position and they're not moving at all. This happens to a lot of schizophrenic patients. Okay. They kind of just sit there. Even sometimes it's known that they stand on one foot and they just sit there. They're catatonic. That's, if they're not moving, is that positive or negative behavior?
It's positive behavior.
If they're not moving.
Oh, negative.
Negative. What if they're moving around a lot? If they're popping, what's that, positive or negative?
Positive.
That's right. So understand this, catatonia, they're catatonic, meaning they're not moving, they're locking, and that's negative behavior. Does that make sense?
Yes.
You need to know this word, catatonia, because the patient could be having a catatonic episode, which means that they're locking, they're not moving, and that's negative behavior in mental health. Does that make sense?
Yes.
All right. Okay, now we're getting somewhere with this. Any questions so far?
No.
Explain to me, in your words, what does bipolar disorder mean?
Bipolar is when you're in a state of mind where you stay in one state and don't move.
No, that's catatonia. What's bipolar disorder?
When you're just gloom and in one position.
Not the position. The position is catatonia. Bipolar disorder. What's bipolar disorder? Check out your notes if you can.
Okay, let's see. When you have emotional swings.
There you go. Emotional swings. From what to what?
Catatonia to potluck.
Not catatonia to potluck. That's a specific type of, remember,
Positive, negative.
That's positive. That's also not it. Hold on, slow it down a little bit. Remember, bipolar disorder is a mood swing. From what to what?
You can be from positive to negative.
It is technically yes, but give me something more specific, like the definition. I talked about when we were looking at the spectrum, when we were looking at this. Watch. I showed you like an arrow like that from one type of mood to the other. What was it?
You can be happy one moment and then next minute you can be sad.
There you go. That's what I'm looking for. You could be depressed.
And then you can be talking the next moment.
Then you'll be just having a lot of activity. We call that mania. Mania. Remember, the mania is like the patient can't sit down. They want to do stuff. It doesn't mean that they're happy. It just means that they're on one.
So like one day you can just be where you don't want to get out of bed. The next moment you're trying to do all kind of stuff.
Exactly. That's bipolar disorder. That's bipolar. Understand that mania is the part where you have that positive behavior, which is behavior that's a lot of physical activity. Depressed section is when you have that negative behavior. And catatonia is where they're not moving.
Okay.
And that could happen usually in schizophrenia. But I'm just giving you an example. I talked about catatonia to describe the whole positive and negative behavior. If you're catatonic, you're locking. You're not moving. You're in a particular position and you're not moving. That's called negative behavior. But if you're manic, you can't sit down. You can't sit still. You're euphoric. When you're euphoric, it's like you're high. And you're just like in la la land. And you're kind of just like, oh my God, there's so many things to do. This is awesome. Not necessarily happy. They're on one. You've had patients like this where
right.
you can't get them to shut up. You can't get them to sit down. They're not necessarily happy. They're just on one. It's like you gave them a crack or something and they're just on one. Does that make sense? Are we clear on that?
Yes.
Okay. So, any questions on that?
No.
Here's another question about what we talked about earlier. When somebody has diabetes, mellitus. What are they not what is their pancreas not producing?
Insulin.
Beautiful. If they have no insulin, what happens to their blood sugar?
It goes up.
That is correct. Let me tell you right now something, Miss Jennifer.
Yeah.
You have no issues with comprehension. You have no issues. You have no issues with I guess people would say like, oh, I'm just slow. You have no issues with that whatsoever. You know what your issue is?
Hyping me up right now.
What was that?
I said, you hyping me up. I'm going to be all right.
It's the truth. Because listen, I've had students that's their problem. And when it comes down to that, I tell them, listen, I need you to go read something and we'll meet again in 2 months because I can't, it takes too long. But you're not that patient. You're not that student. Okay? You have no issues with reading comprehension. Your issue is you are lacking a lot of foundations. That's easy to fix. It just takes a while.
Okay.
Okay? So just understand that. Remember that. I've done, this is what I do for a living. I've done this for a long time. You have no issues with reading comprehension. There is no issues with you not being able to comprehend things. Your issue is that you need a way to understand this stuff. And you just need to have a revision with a way that you can understand it, that you can absorb it. And that's what I'm gonna provide for you, okay?
Thank you.
No, thank you. Let's continue real quick. Oops. All right, let's continue. I think we had a question about mania or something like that. Let's see. This question says, a nurse is collecting data from a client who has bipolar disorder and is experiencing acute mania. What does acute mean?
Like on hand?
I know what you mean by that. I want you to now, instead of saying on hand, I want you to think of this. Sudden onset. You're right. I know that's exactly what you mean. But instead of saying on hand, that's too vague. When you think of on hand, the feeling that you get when you're saying on hand is correct. I need you to now use the correct terminology. Sudden on. It happens suddenly. Okay, that's what acute means. Sudden onset. What does mania mean? Can you get this patient to sit down? What's this patient doing?
Moving all over the place.
There you go. Can they stop talking?
No.
Can they stop thinking?
No.
Can they shut up?
No.
Good.
Got a couple of those.
Yeah, you do, right? So then again, it goes, a nurse is collecting data from a client who has bipolar disorder. You know that's the swing from depression to mania. Right now, they so happen to be in the mania part, right? That's where they're at. Which of the following findings is the nurse's priority? Now, check this out. When you see this word right here, priority, that means that all of these may very well be correct answers. Priority is letting you know that most likely you're going to have at least 2 of these answers that are part of mania. But when we say priority, this is what you want to think about. Always prioritize with ABCs. Anything dealing with airway goes first. Breathing goes second. Circulation or bleeding is then after that. When you think of priority, you always want to treat acute issues before chronic issues. Meaning sudden things that happen fast before things that develop slowly.
So would be pressure a speech?
I don't know. Let's find out. Pressured speech. Is that your answer?
Yes.
Nah, not this one. Check this out. You also want to think of one more thing that you probably would have gotten it after that. Do you ever remember this part? Maslow's
Loss.
hierarchy of needs. I think I misspelled that, but Maslow's hierarchy of needs. Do you remember that?
Yes.
Maslow's hierarchy of needs is this thing that this white guy created. But guess what? Usually they're wrong, but he was right. Sort of right. And they use this triangle to explain what a human's priorities are. First of all, this is priority. The bottom one, it's 1. Then it's this one. Then it's this one. Then it's this one. Then it's that one. Write that triangle. Let me know when you got it down with those numbers next to it.
Take a picture. Okay.
Okay. What you need to know is that when it comes to Maslow's hierarchy of needs, this is going to help you answer these priority questions. Okay. Because sometimes ABCs is too obvious. Do you recall that in this question, ABCs is not there? You notice that?
Yes.
It doesn't say anything about airway, breathing. It doesn't say anything about that. So then we have to get a little bit more specific. So check this out, okay? These are considered, 1 and 2 are your basic human needs. Maslow used to theorize, used to think that when it comes to addressing people's problems, there's a degree of hierarchy, meaning you have to address certain things first before you start addressing other things. Does that make sense?
Yes.
So the first thing you have to address is anything dealing with physiology. Physiology, we're talking about your food, your water, warmth, rest, the things that your body needs, nutrition, oxygenation. Does that make sense?
Yes.
So when we're talking about prioritizing, you always want to prioritize with anything that deals with physiology first.
Okay.
After you've addressed all the physiological issues, now you can move on to the next category, number 2. This talks about safety. Safety deals with security, like putting the bed at its lowest position when you leave the patient's room who's at risk for falls. Does that make sense?
Yes.
Safety is like a patient who has Parkinson's, which they're always shaking. You want to provide good shoes that have good grips. You have to provide them with maybe a walker or something so they won't fall on their ass. You follow?
Yes.
That's what safety indicates. That's after physiology. Once safety's been addressed, then you move on to number 3 and number 4. These right here are known as psychosocial needs. Psychosocial needs are talking about the way that you communicate and interact with other people. Okay? The third one is known as belongingness and love. Being cared for by your loved ones, having someone that loves you, having someone that can meet your emotional needs. That's what the third one is. But doesn't it make sense that that's after being secure? So in other words, physiology means you need oxygen before, and you need oxygen and you need food before you need a house, which is safety and security. After you get a house, now you could find someone that will provide you that social interaction, that sense of, oh, I have somebody, they love me, a husband, a wife, a friend, companionship. Does that make sense?
Yes.
Then after belongingness and love, now because you have people that love you, you have a good sense of yourself. You feel good about yourself. So now we address esteem issues, self-esteem issues. And what I mean by that is you're feeling good about yourself because you are now an LVN and you feel good about yourself. Now that you have your partner that loves you, now that you have your children that love you, which is belongingness, now that you have your family, now you feel good about yourself. You're like, man, you know what? I'm a good mom. I'm a good dad. I'm a good nurse. I'm a good worker, whatever the case is. Now you can address self-esteem issues. Does that make sense?
Yes.
And then the last one is known as self-actualization. That means that you can look back. I'll draw this right here. And notice I'm kind of looking downward. You can look back and you can see all these things that you've already done and you can feel good about yourself. You feel actualized. It's called self-actualization. And that's the last step. That's when you're like 75 years old, 60 years old, and you can look back and say you feel good about everything that you've done. Meaning you became a doctor, you became a nurse, you became a mother, a father, you raised your children. Now you feel satisfied with everything that you've done. This is how we treat priorities when it doesn't deal with ABCs and acute before chronic. You always have to remember this that particular chart so you know how to address things. Does that make sense?
Yes.
Now, any questions on this so far?
No, I understand.
Okay, now let's go back to the question, okay? Don't feel bad that you get them wrong, okay? So again, a nurse is collecting data from a client who has bipolar disorder and is experiencing acute mania. Which of the following findings is the nurse's priority? Now remember, the manic episode can't stop moving. They're all over the place. Let's find out. You said pressured speech. Do you know what pressured speech is?
No, I thought it was speech because of them talking, but
Okay. So that means you didn't really understand the question. The question was not asking you what are the signs and symptoms of mania. It was saying, which of the following findings is the nurse's priority? What are you going to test first? We know that they're going to be talking all over the place, all out of their neck and all that crazy shit. We know that because they're manic. They're suffering from mania right now. We expect that. So that's probably not going to be your priority right now. Let's see what else we have. Okay. Flight of ideas is similar to pressured speech in the sense that it's the way the patient's behaving right now.
right.
Both of those, pressured speech and flight of ideas, are both signs and symptoms of mania. So when you have two terms or two options that are saying the same thing, why would one be the other over the other? So those are not it. Poor concentration is going to happen. You're going to expect that. But check this out. Lack of sleep. If the patient's not sleeping, that means that their body is not fully resting. They're not resting. That means that if you understand what happens when you don't sleep, you can start developing hypertension. And isn't hypertension and being fatigued, which places the patient at risk for injury, correct? If they're fatigued, aren't they at risk for injury?
Yes, they're tired.
So, yeah, you're tired, right? They could fall asleep behind the wheel, not to say that they're driving, but the idea is that if they're not sleeping, their brain's not rested. They're not restoring their energy. It can lead to hypertension. It can lead to fatigue. And aren't these things that we're talking about, hypertension, fatigue, injury, these two right here deal with physiology.
Okay.
This one right here deals with safety. So you see how the other ones are just parts of the manifestations of mania? So lack of sleep is your answer. You don't necessarily have to know that lack of sleep is the answer. You have to understand these elements, that physiology and safety always come before the manifestations of mania because we expect those things. So if your patient hasn't slept for 3 days and they're talking they're talking out of their ass and they're talking about they're going to buy Bitcoin and they want to go and become whatever, they want to go to night school and all this nonsense, we don't care about them saying what they're saying. We care the fact that they haven't slept because then they're going to be really fatigued. Their vital signs are going to increase. They're not going to be able to rest, which means that they're going to be tired, falling asleep randomly. They're going to be at risk for injuries.